What up, Z-Pack? It's your boy, Z-Dog-MD. Check it out. It's Incident Report live from the road, Washington, D.C. edition. In this week, I've been in South Padre Island, Texas, San Diego, California. Now I'm in Washington, D.C. to do the World Healthcare Congress. Tomorrow I'm in Miami to speak at MCG Health, and then I'm back in Vegas. But I've been a little remiss in my broadcast because I've been flying and busy and crazy. And I've been eating out of hotel rooms. I've got my chicken Cobb salad here. I just had, what else did I have? I cheated a little on the carb thing, and I had a grilled cheese sandwich. So now I'm going to get GERD, and it's going to sound terrible. But I wanted to connect with you guys today, even though it's an odd time, because my talk today is at 4 Eastern. So I wanted to get on the line because Tom just sent me this clip of Jimmy Kimmel talking about his newborn son's heart surgery. And he was doing the monologue for a show, and it was so emotional and talking about the son's birth, which was normal, but then this very rapidly evolving situation where it became clear that the son suffered from a congenital heart defect. The son's name is Billy, and had cyanosis and rushed off to surgery and ended up having tetralogy of Fallot, which is a heart defect that many of us know has to do with a ventricular septal defect, a hole in the wall between the two big pumping chambers of the heart, as well as atresia or narrowing of the pulmonary outlet tract of the heart, and sometimes an aorta that can override both chambers of the heart. So the net result is that deoxygenated blood from the body ends up mixing with oxygenated blood from the lungs and gets pumped out to the body and brain. So you end up with this deoxygenated blood that contains, CO2 and not enough oxygen, and that can cause the blue cyanosis that you see in children. A lot of times the kids come out and they've compensated. Their right heart is thick because it's trying to struggle to pump all this blood in the setting of the hole in the heart and the blockage of the pulmonary tract that goes to the lungs from the deoxygenated side of the body. And so in the old days, these children would die. In the new days, if caught early enough and sent to surgery quickly enough, they can survive. And Jimmy Kimmel tells this harrowing tale, and it begins with the nurse. I think it was Narush. I forget her exact name, but I just saw the clip. And at Cedars-Sinai, and she listened to the child, heard a murmur, which isn't uncommon in infants, but noticed there was some cyanosis, some bluing of the baby's skin. And in the setting of that, she quickly activated a response that led to a bunch of docs coming in, and the next thing you know, they pulled in the cardiac surgeon. He was at the airport picking up his mom, and rushed to surgery, and I think repaired the ventricular septal defect first, is my understanding, although I may have misheard it and I was trying to listen while doing a million things. But in any event, the child is alive, is no longer cyanotic. We'll need to go back when he's older and stronger for a repeat surgery to finish repairing some of the defects. And it was a miraculous story of modern medicine working. And it began, what really struck me, and of course, Jimmy Kimmel as a father and any of us who are parents can empathize with this, was incredibly emotional talking about it. And anyone who's just had a child and has a child who's sick knows this feeling of being very emotional and feeling connected and grateful, mixed with scared, and this overwhelming sense of love. And watch this clip. It's on YouTube. I'll try to put a link into it after I post this video and in the podcast link. It's remarkable to see how the love of a father for a child manifests on live television or recorded television, whatever it was, in front of millions of people. And it was a beautiful thing to see. Now, it all goes back to this nurse, I think it was Narush, who caught this early. And Jimmy goes on to thank everybody on the team, but especially this nurse. And again, it reminds us as we go into Nurses Week next week, how important nurses are to everything, right? The whole team is important. That's what it reminds us. It's not about, the cardiothoracic surgeon who walks around like a god. And speaking of which, this whole episode was followed by an appearance by the Dark Lord, the MD who shall not be named, Dr. Oz. Just turns out he had won an Emmy the night before and was supposed to be on Kimmel's show to gloat about beating his own daughter for the Emmy when this thing happened. And so, of course, he pulled out the video and was like, okay, this is how the heart works. And he's talking a million miles an hour because he's probably high on coke. And because that's all celebrities, you know. I'm hoping to get to that level of celebrity where I can be high on coke. I've never tried it, which is a bummer. I'm hoping to try it and, you know, Len bias out, just tap out of the game right there. So Oz is like, on the left side of the heart and the right side of the heart. And Jimmy, by the way, you know, nurses, you know, they are great. Those women are fantastic. And Jimmy had to remind him that it's not just women who are nurses. And then he went and told the story about how Chiang Kai-shek came and sent his nurse to him in the 70s or 80s to operate. And again, it's like ego and ego and ego. And then he goes on to say, and we shouldn't have an ego because we have lives in our hands. And if we're taking responsibility for saving lives, we have to take responsibility for losing them as well. And I think it's more egotistical to talk about taking responsibility for someone losing their life when it's really the disease process that you couldn't stop. And you should take some responsibility. But feeling that you were a god enough to control life and death, Oz, is a little bit much. And I know you're a cardiothoracic surgeon. I know that's what you do. But let's go back to Jimmy Kimmel, because this was really about him. Suddenly, Oz made it about him, because Oz starts telling the story about his own daughter, how the cord was wrapped around her neck because it was delivered by, you know, it was delivered with a midwife, and they noticed the cord was wrapped. And she, Jimmy, Emily was much bluer than Billy. Like it's a freaking contest as to whose child was more cyanotic when born, okay? Guys, if you wonder why I'm constantly hating on Oz, do you really need to wonder? Anyways, back to Jimmy Kimmel, because I could talk about Oz all day. The beautiful part of his story is he was human, he was vulnerable, he talked about how scary it was, and then after that, he made an impassioned plea, which I thought was the most beautiful thing I'd ever heard. He said, listen, guys, like no one should have to worry about their child dying because they don't have money. In the old days, right, this would have counted, this tetralogy of Fallot would have counted as a pre-existing condition, and my child wouldn't have been able to get insurance and probably wouldn't have survived even to the point where he was applying for insurance. And you shouldn't have to worry about that. We're better as a people, whether you're whatever side of the political divide you're on, right? This idea that we should take care of each other is a transcendent idea. And it's not like you're on this team or that team. We're all on the same team, and the team is called the United States of America. And I thought that was absolutely the kind of transpartisan healthcare statement that's based in humanism and compassion that we ought to be having on both sides of the political aisle when we're talking about healthcare. And this is a great example. Here's a super rich guy who still is like, oh my God, my child is going to die, right? It transcends everything. And it shouldn't be that somebody born in, into poverty should have to make decisions revolving life and death for their child. This should be something we do, all right? That's my take. And maybe I'm wrong. Murica. The team is called the Human Race, Tammy Lynn. See, Tammy's a little more advanced because we go beyond tribe and nation to all conscious entities when we really expand our thinking, but we're not all there yet, and it's hard. It's hard because you have to go in sequence, people. Let's read some comments. Alexander Wu. Logan! I guess Logan's here. Julie Garrett. Oz needs to go away. He sells out to whoever gives him a bigger check. The things that he slings on his show terrify me. Well, Julie, you and I both. Murica, says Evan Fox. And Joe Richard just gives us an American flag. Yes. By the way, I want to tell you guys a quick story. So, of course, Jimmy Kimmel, the other thing that he pointed out was that nursing is crucial to the medical team. And even Dr. Oz said cardiothoracic surgery is a team sport, which it absolutely is. Everybody, right? The respiratory therapist, the physical therapist, the occupational therapist, the dietitian, the clerk at the front desk, the medical records people, everybody, procurement, everybody in the hospital functions in a way that each of them is the most important person on the team taking care of the patient. At a given time, they're doing their job. And we have to remember that when we're so often siloed off, we don't talk to each other, we don't understand each other, we don't walk in each other's shoes. So this is a great example. When everything goes right, every member of the team fires on all cylinders, and you end up with an outcome like this, where this child is saved. And when Jimmy asks for more funding for research, when he asks for more compassionate policy around health insurance and healthcare reform, I gotta support him on all those things because I think he's spot on. When he brings Dr. Oz on the show, I gotta give him some shade. I'm gonna throw some shade at you, Jimmy. I know maybe they're both NBC guys or whatever network they're on, but have me on the show, Jimmy. We'll have a real talk with Z-Dog MD. Anyways, the point of all this, the American flag piece that I just saw posted. Yesterday, I was flying in from San Diego to DC, and it was late at night. I'd flown in through Atlanta, and I was listening on my headphones to Hamilton, the musical soundtrack from the musical Hamilton, and it was the song where George Washington tells Hamilton, if you know this piece, that he's going to resign, that he is going to step down after one term so that he can teach them how to say goodbye, teach the American people that he's not a monarch, that the presidency is an elected post, and that he can step away and make room for the next person to come. And he was the first president and the first to do that. And then they read his beautiful speech that he gave, his sort of resignation speech, and how it was this anthem for building this country. And as this is happening, I'm listening in the headphones, we're landing in Washington, D.C., and we took a flight path that I've never seen before that I didn't even think was legal after 9/11. We flew right close to the Washington Monument. You could see the Lincoln Memorial and Congress there in the distance. And it was right along the Washington Mall and flying like, literally, it felt like the Washington Monument was this close. And as we're landing, I'm hearing this music, and I just felt this upwelling of pride and emotion and love. Because so often we can be cynical about this country. So often we can be cynical about politics. So often we can, be like, I'm just going to leave. I'm going to go somewhere where they have universal health care and I'm taken care of and da-da-da-da-da. And then you reconnect with the purpose and the passion and the promise of the United States of America, and you realize we can do this together. We can actually fix healthcare in this country in a way that no other country has done it. We can be a beacon again to the world of how to do this, and we can learn from other countries. We can learn, right? But we can do it because we are freaking awesome, people. We are awesome. The American experiment. It's like nothing that has ever happened in the history of the world. It's our chance to make a dent in the universe. Let's not drop the ball. So suck it, Canada. Anyways, that is pretty much the broadcast for today. I wanted to bring attention to Jimmy Kimmel's speech. If you haven't seen it already, watch it. I'll put it in the links. Watch Dr. Oz's follow-up because I want your opinion on that. I'm actually glad Oz was educating a bit on Tetralogy of Fellow, although I think he went too fast. And let me know what we can do better to educate and entertain and make this movement happen, this Health 3.0 movement. Today I'm going to give a talk to the World Healthcare Congress. There's all kinds of luminaries, and believe me, I'm wearing a hoodie, and I'm starting out by the song Low, because I want them to know what the outpatient clinic is like, Shorty had them apple bottom scrubs, Crocs with the fur, Everybody be in their suits like, oh, what's going on? Oh, snap. Because that's how we do it, people. All right, guys. Incident Report Mobile, Z-Dog MD, and we out. Peace.